Everyone, it's Dr. Russo. We're here 1 week out, so I know Janee's excited to get this drain out. So we're going to get this drain out, and she's going to feel much better once that's out, but she's healing great. Watch this.
How much is this going to hurt?
It actually shouldn't hurt.
Oh, okay.
Yeah. It may feel a little uncomfortable, like
okay.
I'm pulling on the inside of you.
Okay.
But it shouldn't hurt.
Okay. So I had a lot of questions as, you know, I was recovering and posting, of course. How long is recovery from this type of
Well,
procedure?
I mean, it depends on how you define recovery.
Right.
If you mean feeling like 100% normal, I'd say 1 to 2 months. If you define recovery with final scars, it's more like a year. So this is a long process.
Right.
But if it means resuming your previous normal activity, that's like a month.
Okay.
Yeah.
Okay.
Can I ask you a question?
Yeah.
Do you see
That was
Okay.
this morning.
All
It
right,
wasn't
got
always
it.
like that.
Okay. Good.
Yeah. No, it wasn't always like that.
All right, here it comes. Don't anticipate it too much.
Okay, because I definitely was.
Don't focus on it at all. You're doing great.
Okay.
Doing really great.
Okay. I think he's already pulling it. As he's talking me through.
It's out.
I was like, I feel
Yeah,
like
I wanted to see what you said. I'm sitting there just holding it. But I do want to show it to you. I'm going to tape you up, but I'll show you something because it's pretty neat.
So you don't have to do like a stitch to close it or anything? Okay.
Your body closes this up in like a day or two.
Yeah. Gotcha.
Yeah.
Okay.
The body is an amazing thing. As long as we set the stage for your body, your body does a lot of work.
Okay.
Yeah. Some of your steri strip did fall off back here.
Yeah. And
There
I
are
think in a couple places.
Yeah, there are areas that just rub a lot, especially with the ACE wraps. You won't run into that quite as much when we get you in the faja.
Okay.
So that'll be good.
Okay.
This is why I wanted to show you though.
Yeah.
So here's your drain.
Yeah.
Okay. So that's the bulb that was collecting things. Do you see this stitch here?
Yeah.
Right there?
Yeah.
That was at your skin. All of that was inside you.
Across my
entire
back?
thing. Yep. Yep. So. Yeah.
And there was no clot, so it wasn't like anything was blocking.
No, everything's just dry.
Yeah. Okay.
And your back looks great.
Right.
You have very little swelling here. You've got a little bit of swelling underneath. So the little bit of swelling underneath, that's all normal.
Yeah. Okay.
This part, so the way to kind of think about this is swelling happens especially under skin flaps. So when I remove skin, it's not like I'm taking a V out and putting it together like that, okay? It's more like I'm cutting down on one side and then I'm undermining another, and I have this one-way flap moving a lot. So for your back, you don't undermine, you don't go under the top as much. What I do is I go under the bottom, and the bottom is moving a lot.
Gotcha.
Okay? So it's the opposite of a tummy tuck. With a tummy tuck, we go under the belly, and then we pull down a lot. But that's where you're going to develop, because there's a plane between the flap I moved and your muscles underneath where fluid will develop.
Yeah. Right.
So in this case, it's underneath. Okay, in your arms, it's posterior.
Right.
Okay, so that's where you're going to expect most of the swelling.
Gotcha.
You won't have as much anterior or above the incision. It'll all kind of be below because of gravity, and that's where the flap is. So that's how it works.
Gotcha.
Okay?
Okay.
But your entire incision looks beautiful. I want you to just keep this area covered. Did you see this area? This is just where the steries fell off.
Yeah. So we're not going to put anything new, any new surgical tape or anything?
I could put a little bit. I'll put some new steries on there.
Okay.
That's the surgical tape.
Gotcha.
This is looking really good. Yeah. You're collecting a little bit of fluid right at the elbow. Yeah. That'll go down over time. Yeah. The faja you have goes past the elbow, right?
Yes.
Okay, that's really important because we really need to squeeze all this out.
Okay.
Have you had a lymphatic massage?
I did yesterday. Okay. Yeah.
How'd it go?
It went fine.
Good.
She was putting pressure. I thought it was going to hurt. It really didn't.
Good. You do have a fair amount of bruising here, and that'll go down over time. Yeah. So you basically collected some blood and fluid behind your arms, and that'll transiently go down. We just need to allow it to go down.
And is that due to the lipo? or just?
It's due to lipo and, like I said, the skin flap.
Oh, okay.
So essentially, I undermined all of this. So there's a space for fluid to sit.
Gotcha.
Continue elevating your arms and compressing your arms. That's going to be the treatment for it.
Okay.
Okay. And time.
Gotcha.
Time is the treatment for most of this stuff.
Gotcha.
And just try to be patient.
Yeah.
And that's usually the hardest thing for our patients, because especially patients that have undergone such a dramatic lifestyle change, their activity level is very closely linked to their like emotional wellness. So telling you to just slow down and stop and stuff like that can sometimes be hard to hear, and it's even harder to live through. So just understand it's important that you slow down for healing.
Gotcha.
Even when you want to get back to it.
Caroline.
Yeah, yeah.
She has to pop me yesterday.
Oh
my God, girl!
No, literally. Everywhere she said, she would go.
I
Oh
was
my
moving
gosh.
a bit fast.
Yeah.
Like,
yeah.
and like
I have to be
literally
dramatic
day one
for it.
post-op, I was moving fast,
Yeah.
and then I saw stars and things started getting black, and then I was like, I need to sit. My mom
Yep.
was like, yeah, you're moving like you didn't have surgery.
Right.
Yes.
And I'm
yes.
like, I feel fine,
Yes.
but my body isn't.
That's right.
So,
Yeah, you just need to know that you had surgery.
Yes.
You have to limit your activity for 2 weeks.
yes.
You're going to really limit strenuous exercise for 4,
Mm-hmm.
and just take it really slow.
Gotcha.
That could be a reason why you're more swollen now
Yeah.
than you were day one.
Yeah. Yeah.
So it's probably related to your activity level
Yeah.
Yeah.
and normal healing. You know what I mean?
Yeah.
But
She has been sitting, but there's times I'm
the
like,
most, your back has like almost no swelling.
Yeah.
It's very,
It's-
and that's why the drain didn't put out much.
Right.
It's your arms.
Right.
And that'll just take some time.
Right.
Okay?
Okay.
But I'm still loving it.
What about the sides? My incisions on the sides.
They look great.
They look great.
Yeah.
Okay.
Mm-hmm. Yep. Love them.
So I know we were talking about the redundancy and like the lift and the tuck,
Mhm.
and so I see this arm looks pretty like smooth, like flat, like there isn't much.
Mm-hmm.
But this one I noticed that
Mm-hmm.
there is. Do
Yeah.
you think that's swelling or is that still skin?
It's hard as it's mostly swelling because on the table we
Mhm.
did do a really good pull.
Mm-hmm.
Here's the thing. It's really important to kind of understand that. Yeah. It's really important to understand, and I think I talked to you about it. I recently talked to another patient about it, but the tightening that occurs is always perpendicular to incision lines or scars. So when you have scars that run this way, the tightening is this way, right? In order to tighten this way, you need to put an incision this way or
Right.
oblique, right? To pull things up. So the way that we accomplish that with this incision is I took this skin and pulled it this way and it bunched here. And then I pulled it this way, bunched here. Then I pulled it until it bunched under your breast, and then I could basically take out a triangle to make up for that difference.
Right.
We pulled as much as we could without compromising blood supply.
Right.
That's the key.
Yeah.
Now, after you heal, if you notice a little bit of redundancy, you know what? Once you're healed, now I can make transverse incisions wherever I want.
Right.
Right? Because
Okay.
you're healed.
Right.
So, or we could do revision lipo if
Right.
it's just a little fat deposition or something like
Right.
that. My hope is that this will solve. I think a lot of this is just swelling.
Yeah.
Like you could feel it. It's
Yeah.
just like, it's like a wet sponge. You know what I mean? So I think that we need to give it time.
Yeah.
I wouldn't touch anything, even if you had certain concerns. I wouldn't touch one thing for 6 months.
Yeah. Oh, I didn't plan on
So yeah, and I think that you're going to be really happy.
it. Yeah.
And like we discussed before, it's one of those things where just because of how heavy your arms were
Yeah.
over your elbows, we're limited by what we can do, and you'll
Right.
likely have just a little bit of heaviness over the elbows still. But when we were done and cut that last suture, you had much less than this. So I
Right.
think
Yeah.
that
Like
that's
even
swelling.
now
Yeah.
with the sweat, like
Yeah.
I'm happy.
I know.
I'm
Yeah,
happy.
it's a big
But I know it's going to
difference.
be a question that comes up in the future,
course.
and so I wanted to
Yeah.
be able to.
Well,
answer
you could
that.
really get a good idea of your results on the table,
Right.
Because after that, it's things like swelling,
Right,
fluid
yeah.
retention, Sometimes people have wound issues where things open up or shift on you.
Yeah.
Your incisions look absolutely beautiful.
Great.
There is not one space that I'm concerned about an infection right now.
Okay.
And the place where I normally see things opening up on me, armpit.
Yeah.
And your
Did you
armpits
check
look
out-
good. Yep. I saw them when you were there.
Yeah.
I don't go in there, but I
Yeah.
can see it. The tape moved just slightly,
Yeah.
but overall the incisions look really good.
So we don't have to worry about. I just need to make sure to dry it really well.
Yes.
Okay.
Keep it clean and dry.
Okay.
I may just like reinforce that one
Okay.
with some tape.
Gotcha.
Another area that was difficult to manage,
Mm-hmm.
and I don't think that we couldn't see it as much until you were laying down.
Right.
But your lap, just next to your breast, you had a lot of redundancy there. Did
Yeah.
you see it in
I
that
saw it in
picture when
that.
you're on the
Mhm.
table?
Mhm.
There's just this big
Bunch of skin. Yeah.
and that went up into your armpit.
Yeah.
So another thing that we really had to aggressively try to do is bring that down.
Yeah.
And that wasn't easy either,
Mhm.
but I'm really happy with how that looks. And again, it's swollen.
Right.
So
Right.
it'll just take some time.
Yeah.
And then the other thing is we cut nerves in that area when we do this. So it's normal to have numbness, tingling, stinging, burning, itching. All of that is just nerves regrowing.
Gotcha.
And they're finicky little guys. They regrow very slowly and they present themselves in different ways. So I can't really, I can't say you'll be numb here, you'll hurt there. It's
Right.
just,
It's just-
nerves will present themselves. in
And
all
how
sorts of
long would
different ways.
that the regrowing?
4
I
to
guess?
6 weeks.
Okay.
Yeah, usually.
Okay.
Yeah. It could take months for numbness to resolve.
Mhm.
That's more something like when we're going across nerves.
Mhm.
With this, we're going with nerves a lot of the time. But for bellies, for instance, your nerves, your sensory nerves go up and down,
Mhm.
and we cut right through all of them with the belly. So it's very common to have numbness with a belly for a
Gotcha.
while.
Gotcha.
Yeah.
Okay. Okay. When can I drive? I mean, not that I'm in a rush. My husband's gonna do all the driving, but
Yeah.
you know,
take advantage
just
of it
for
while you
yes.
can. Yeah, it's like, oh, I don't want you cooking,
Yes,
cleaning.
Nothing. Lifting.
Yeah, no
nothing.
driving.
No.
You need daily foot massages.
Yep.
Yes.
Yep.
Right? No, it's as soon as you're off pain medicine, it's technically safe to drive.
Oh, okay.
Okay. So that's the rule I make.
Okay. And then I'm pretty much almost out of the high whatever.
Dracodon.
Yeah.
Dracodon.
Yes.
Mhm.
Is it fine for pain management that I do like Tylenol?
Sure.
No.
Just regular Tylenol.
Just,
Because I've been without
Tylenol's are
it. I've
fine.
been
Yeah,
without
Tylenols
it.
are fine. If you need a refill, just let me know.
Okay. I don't think I'm going to. I've
Okay.
been trying to wean myself off of both.
Good.
Mm-hmm.
So I really don't like taking medicine anyway. So
Yeah, me either.
yeah.
Yeah.
But I just wanted like something lower dose
Mhm.
if I wanted to still kind of tackle the pain.
Yeah.
Okay.
Tylenol's the perfect choice.
Okay.
Yeah, just don't go over 4 grams a
Yeah.
day.
Yeah.
I need DVT prevention. That's a question.
Oh yes, DVT prevention. Like how
Walking.
long do I have to? It was how long do I have to worry about DVT?
It's usually a 2-week window.
2 weeks.
Okay.
Okay. Okay.
Yeah.
Okay.
We walk every day.
Yes.
So that's
hmm
Yes.
Yeah, compression stockings are good
Yeah.
too.
Mm-hmm.
hmm
Okay. Oh, you did say, since you did such a great job, kudos to you on my back, that you don't think I would need a 360 now.
Potentially. So
Yes.
I wanted to see you again. Do you mind if I bring
Yeah,
this
yep,
down a little
yep.
bit? Yeah. So because of this pole,
Mm-hmm.
it did soften this. What I do think, you see this area
Yeah,
right
that's
here?
what I was thinking too.
So we might be in a position where instead of a full 360, it would be we may stop here or
Yeah.
something like that. We'll see.
Right.
We'll play it by ear. We'll let you completely heal
Right.
and then make that decision.
Okay.
But I do think so. A tummy tuck typically won't get this.
Yeah.
It'll get you to about, even if I extended it, if I didn't extend it tummy tuck to here,
Mm-hmm.
you'll
would
still
still
have
have
a little
that,
bit of
yeah.
right there.
Yeah.
So if this is an area that concerns you, and this won't be resolved with just lipo,
Right.
because it's excess skin. If I just lipoed this, it would probably get worse
Right.
actually,
Right.
and like fall over your pants more.
Right.
But let's we'll cross that bridge when we come to it.
Okay.
Yeah, we're only gonna do what you need.
Yeah.
Yeah.
Yeah. I was like, it would be weird to have like a small little gap, but then also if I don't need to be cut all the way around.
Actually, it's it is a little weird, but I like to do that when I can.
Okay.
Because when you do a 360, there's a natural skin fold that goes up from your gluteal cleft or your butt crack. And when you do a 360, if you take that skin and you're lifting from below, you can actually, your gluteal cleft can ride higher. So you can have an elongation of your butt crack, basically. So we can avoid that by not taking that skin. But that's just something that we need to understand is a possibility when you go all the way around.
Right. Okay.
So
Yeah,
there are pros to not having to go all the way around. So if we don't have to, I'm not going to.
Right.
But we may have to.
Yeah.
The time will just tell.
Okay. Gotcha.
Yeah, it's too early right now.
Yeah. And then if there were any concerns with my arms in the future, like, oh, maybe we could do a little, is that something that you could just pair with a future tummy tuck?
Totally.
Okay, because I really don't want to have to go under the knife 3 times.
Yeah.
2 is fine for me.
You don't like me enough for 3 times, just 2.
Yeah,
Got
yeah,
it.
2
Okay.
is good. So whatever you can do, I'm just
It's all
gonna be
good.
happy with.
Yeah.
You're gonna have to do everything in that second
Deal.
one, and that's it.
Deal. Yeah. But it was a lot of work. I mean,
Yeah.
it was almost 7 hours.
Yeah.
Yeah. So
Yeah, I was
I'm
telling you,
glad
I was
that we
like, I
didn't
feel like
do
he
more
said
than that.
6.5, 7.
Yeah, it was.
Yeah.
It was primarily your back was like easy.
Right.
I think I was done with your back within 2.
Yeah.
It was the arms.
It was the arms
Yep.
and figuring out that extra
Yep.
skin that was there.
That extra skin, your chest wall and extending onto your breast added a good hour and a half. Yeah.
Yeah.
Because it's very complex.
Right.
Because you need to reshape it without lateralizing your breast, without pulling your breast. I need to preserve the breast, especially for a future lift.
Right.
Place the incision in a place where we can go with a future lift,
Right.
but still get rid of that redundancy.
Gotcha.
So we set the stage perfectly for your next
That's good.
breast lift if you decide to do that. Yeah.
Can I ask, like, what would, like, now having done the surgery, would you do something different in terms of, like, the order of procedures?
No, the order of procedures is always determined by the patient.
Okay.
You know, I think it was less than a second after I asked her what bothers you most that she was like, my arms. So yeah, she has multiple areas of her body that she wants to treat at some point, but arms came out right away. So that's where we start. Yeah. There is a sequence to some things where you really want to get one done before the other, but with regard to what you're looking for, it was
And was
arms
it
first.
was it good for me to do arms and back versus arms and breast? And do you ever do
arms,
arms and
back-
stomach?
Yes,
Oh,
but
okay.
that's what I try to avoid.
Yeah.
that is
I know
the
that.
one I try to avoid
Yeah.
because, you know now,
Yeah.
you can't use your arms, so you're relying a lot on
Your core.
to move, to get out of bed, to just get around, or people around you. When you get a tummy tuck, you're going to rely a lot on your arms. You're going to be like pushing yourself up in bed. When you get both done, you're like, you need to be fed. You need you need help just to get to the bathroom for a while. Like it's rough.
Yeah.
Tummy and legs is okay. It's still a little more challenging than tummy, of course, but they go together pretty well. And then tummy and back is easy. Back is good to pair with a lot of different things. The one downside to pairing back with front in any way is, especially if you start considering like BBLs and stuff, it's how you lay. You either need to lay and how your body is positioned. So say a BBL, say I did a back lift in BBL. I don't want you laying on your butt, your new BBL, or extending like this. However, if I do a tummy, you're literally pulled down. So it puts added tension on your back. Yeah. And you can't lay on your tummy after a tummy tuck. That's a mess.
Right.
So you'll hear about people that typically go overseas or somewhere else. They're going to some other country and doing these crazy full body front back. I mean, those people, number one, it's risky surgery. You're under anesthesia a long time. And then number two, the recovery is brutal. So it's not worth it in my opinion. I try to keep my surgeries under 8 hours.
Yeah.
Always.
Yeah. Gotcha.
Yep.
So the way I did it was good.
It's perfect.
Gotcha.
Yep.
Yes. And then breast and tummy for later would be good
Mhm.
too. Okay.
Yep.
Okay.
Yeah, they pair really well together.
Okay.
Mhm.
Cool. And April is I think it's more than 6 months from now. That would be.
Yeah.
That's what I'm looking at. I don't know if that would actually work. We'll just see how things.
Yeah.
But that's what I'm hoping for.
Yeah, play it by ear.
But yeah.
You know, the rule I have is at least a month or 2.
Gotcha.
Usually I like 3 months, but
Yeah.
I've done it as soon as a month later. I mean, it really depends on your recovery too. Just play it by ear. Listen to your body.
Yeah.
You know, I've said that to you a couple times. That really is what dictates it. Like, your body is telling me right now, you're doing a little too much, especially with the swelling, right?
Okay.
So listen to your body,
Gotcha.
right? And then your body told you that you were doing too much when you almost passed out,
Yeah.
for sure,
Yeah.
right? So,
Okay.
but you're doing everything right.
Relax.
Yeah,
That's fine.
yeah.
Yeah.
Don't worry, you're not a troublemaker. You're a good
No,
patient.
she
You're a
is.
great patient.
Thank you.
But it's kind of funny. It's my most like determined and most committed patients to their wellness are usually they can cause as much problems as people that are completely negligent
Mhm.
because they do too much,
Gotcha.
right?
Yeah.
And then you have other people that are like rolling around in mud or not washing themselves for weeks after, and like that's a problem. But that's on the other spectrum. That's just like negligence, right?
Right.
But this can be problematic.
Yeah.
So we really want to ensure that you heal, because when you accumulate fluid, you'll accumulate it fast, but it goes away slowly. So it's like taking you took one step up and a couple steps back, kind of a thing. So it'll
Gotcha.
just extend your recovery.
Gotcha. Okay.
But yeah.
Okay.
I think my question would be like range of motion for her arms.
Mm-hmm.
Like, what is your like how limited do you feel she should be for how long?
Not past 90 for 4 weeks if I can.
Okay.
Yeah.
Okay. And I know you were telling me for my pre-op, like you were showing me the extension, and you called it something like losing the mobility, like the muscle.
Oh, what it's called? When you lose it, it's called a contracture.
Yes.
So that's
So
due
that
to
I would have
Yeah.
to slowly after the 4 weeks start
Yeah.
like stretching out.
I would okay, so you're 1 week.
Mhm.
From weeks like I would say 2 to 4, I want you really pushing 90.
Okay.
Like you want to
Okay.
focus on, and some good exercises are like you take your hand and you just like crawl up a wall
Mhm.
and just slowly get more, and try to get yourself to 90. Don't go through pain,
Okay.
but just do some exercises to get you to 90.
Yeah.
And then after 4, that's when you're working on getting past 90.
Past it. Okay.
Yeah.
Okay.
And I don't want you doing too much of this because it's dependent, like fluid will settle, but just kind of like circles and things like that, or you could do circles out here
Okay.
just to kind of keep things pliable.
Yeah.
The place where people will get tight or a contracture, which is basically scar tissue. So scar tissue is collagen. It's imagine like rubber bands. So a scar will pull things tighter than it was originally, usually, especially if it's inflamed or moving around a lot, especially in darker complected people that have a tendency to develop hypertrophic or keloid scars. Those are extra tight. So I don't want that to happen. But if it developed in your armpit, which is where it would develop, it could limit your ability to get your arm all the way up because it's tight. It's like there's like a rope inside your armpit. And that could be problematic. So it's just something to watch out for.
Okay. Okay. All right. Anything else I need to know these next 4 weeks?
I don't think so. You know, we're going to connect for your 4-week visit.
Yeah.
So I also want, I mean, you and I will be communicating, I'm sure, but also reach out, call me, text me if you have any questions, concerns, issues at all, anytime. After another week, so you'll be 2 weeks out, is the next time that you and I are going to be like really looking at things,
Okay.
because you're going to be taking the tape off.
Okay.
Okay. Then we're going to be looking at the incision and making sure that it's all looking good.
Yeah.
And transitioning to silicone gel or tape.
Okay.
So that's when you begin scar care.
Gotcha.
If there are any areas that are open, oozing, anything like that, no big deal, but we'll give you some like dressing instructions for
Gotcha.
that.
Okay.
So that's when we cross that bridge.
Gotcha.
Yeah.
And we don't need to use the ACE bandages anymore. Or
We're done with
anything.
the
We're
ACE.
done with
Yep,
ACE
done with the
bandages.
ACE. The nice thing about it, so if you look, okay, do you see there are like some, like see some ripples here? Some of that is from the ACE.
Yeah.
Because it doesn't do,
Behind you.
what's
cameras-
that?
the
Oh,
cameras.
sorry.
Yeah. Yeah.
It doesn't do even compression. It's
Yeah.
in bands. Whereas the faja is more continuous,
Even,
even
yeah.
compression, so it'll give you a better contour and it'll help get rid of that swelling faster. Okay.
For the fajas, how long should I be in it? Compression, that whole thing.
24 hours a day for 6 weeks.
Okay.
As close to that as possible. You can
Gotcha.
take it off to shower, but I want you putting it on.
Right back on.
Yeah, and then after that, as much as you're willing to do it.
Okay.
It's interesting. Some people can't wait to get out of it, but a lot of people actually, it turns into this like almost like a security blanket kind of a thing. So they actually like to wear the faja.
Yeah. I feel like that's gonna be me, especially making it through the winter time, because I'm gonna be wearing layers anyway. Might as well just stay closed up.
All right. So where's that?
You really did a phenomenal job, and everyone, like, when I showed the video of me revealing it, everyone's like, "How are you not crying?" I'm like, "Cause I already almost passed out, so I'm worried about not passing." So I'm like, I cried when I watched the video back, but right now I couldn't even comprehend what was happening.
That's so funny.
And I don't have to put any gauze on when I'm wearing my compression or.
Only at the drain site.
Oh, okay.
That's
How
the
long
only
do you
thing
want me to
that'll.
keep that covered?
As long as you need to.
Okay.
It'll probably close up, like I said, 1 to 2 days.
Okay,
And then after
okay.
that, you don't really need it.
Okay.
Let's see. And that's, yeah, it's dry. The bane of my existence with these cases is the armpit area.
Gotcha.
It's just, it is what it is.
Gotcha.
It's very mobile.
Yeah.
It's dirty. So they like to open up.
Yeah.
Same thing with legs. If I go up in the groin area, it's just, it is what it is. It's like a 40% infection rate and stuff.
How much longer should you use the antimicrobial soap?
A week.
Yeah.
Yeah.
For the tummy tucks, I don't have you do it afterwards as much, but for this, it's just because higher wound issues.
Gotcha.
All I did was I cleaned the area with some alcohol,
Okay.
because the last thing you want to do is seal in bacteria if you can help it.
Mm-hmm.
But only for the next week or so would you try to save the incision like this.
Gotcha.
If it opens up after that, then you just do dressing care with like wet to dry gauze or iodoform little strips
Gotcha.
if it's a little hole. But I'll take you through that
Yeah.
if it becomes necessary, basically.
Thank you for taking care of my best friend.
Yeah, it's my pleasure.
Yeah.
It was awesome. Yeah, she's a lovely patient. And
Thank you.
that's why I do what I do.
Yeah, she's very meticulous when it comes to researching and taking care of herself. So you definitely come highly recommended if she chose you.
Yeah, that means a lot.
Yeah, and so like Instagram is on fire about how an amazing job you did. So like big kudos to you and again thank you.
Thank you. Yeah, it's I treat my patients like they're my family,
Yeah.
and I mean that.
Mm-hmm.
You know, when I was in fellowship at Stanford, one of my most respected mentors, who's just a rock star surgeon, he's so gifted. He's an artist and a skilled surgeon, and now he's actually in Dubai. He got an offer. Like he is a university doctor in Dubai, and he did that. He transitioned from Stanford to there. He told me, and I was learning, and I was a doctor. I was already a surgeon. This is fellowship. This is specialty surgery training. I walked in, I'm just like ready to go. I'm pumped, right? He said, stop. And he had me take all my stuff off. And he had me stand on the side of the room. We have our patient draped, so all you could see is their belly, right? And he said, I want you to take a pause before we begin. And imagine that's your mom, your aunt, your sister. Really, really imagine it. Think about it. Think about how much you care for them. Okay, now let's go.
Yeah.
Like something, and that I have that mental exercise every time I begin in the OR. And the funny thing is people talk about, you know, how hard it is to make good decisions. There's these bad doctors, this and that. I mean, it's very easy if you lead with that.
Yes.
If you lead with what's best for the patient, or that you care about the patient, you just want them to be healthy and safe, you don't make mistakes.
Right.
I mean, or that it's your family member on the table, you will make the good decision.
Exactly.
You know what? Sometimes it's wrong. Sometimes complications happen.
Yeah.
Sometimes things happen. However, if you lead with that and you explain it to the patient too, no one will fault you for that.
Yeah.
That's what they expect. They're not out to get you. They just expect you to care. And these doctors that when they run into complications and things, which happen to every busy doctor, every busy surgeon, if any surgeon ever tells you that they don't have complications, they're either lying or they're not operating.
Yeah.
One of the two, right? So everyone has it, but you know,
deal with it.
Yeah, and it's the doctors that all of a sudden they disappear. They don't answer calls. They're like an ostrich. They put their head in the ground and they just wait for everything to die down. That is the exact wrong way to act. When my patients have a complication, I'm like a dog to a bone. Like I'm calling them, I'm on it because I care, right? And I need them to know that. So, and that's what it's about. The most common reason for medical malpractice claims is ineffective doctor-patient communication. If we just are people and we're all on the same team, it's easy. This job's easy and it's the best job in the world, I think.
And I was telling Caroline and my mom, like, from the people who work here, from the people at the surgery center. I know you're moving, so I don't know if you're using the same surgery center, but like everyone I've come into contact with has been great. So I appreciate that because like being in healthcare, I peep all the stuff. I already know how it is. So I'm like, but no, everyone has been great and it makes it better. So like, God forbid if anything did happen, like I'm not sitting here mad. Oh, I want to sue. No, let's just figure this out and move on so I can be healthy. So, and it makes a difference with who is taking care of you, from who's taking care of you post-op, but also who's taking care of you during it. So it's been a great experience for real.
Well, that means the world to me. So thank you.